Greetings. In many countries around the world, including North America and especially Canada, homes don't have strong light sources inside. That's their default. That's the standard. Now, there are cultural and economic reasons for this, and a lot of other things, but that's not what we're here to discuss. Especially in their bathrooms, their washrooms are the same way. Generally, that's the default. Unless someone decides to change it themselves. They use light sources that are very low wattage. I mean, it's fine if they're energy efficient but bright, but they actually use dim ones. So, this issue is about the lighting levels in the bathroom area, like the washroom, toilet, and shower. So, why is that? What does it have to do with health? It does have a connection. It's a place we go to several times a day, every day, where we look at ourselves in the mirror, and it's also recommended that mirrors be larger, which they usually are, and we see things like, for example, urine, we see stool, and we need to see them. I'll explain why now. We need to pay attention, not by staring at ourselves in the mirror for 10 minutes, no, but we should be sensitive to anything unusual we see. What does that mean? For example, we look at our skin, our face, our neck, and if we're about to hop in the shower, for instance, we take off our clothes and check over our body. Abnormal skin conditions, bruising if it's present, like, for instance, a blood clot under the skin, or what we call, for example, a hematoma, or any bump on the skin, an abnormal bump, or a change in the size of something that was there before. Say you had a mole on the upper part of your chest, for example, and now it's getting bigger, it's changed in size, and most importantly, very importantly, asymmetry. Imagine a vertical line down the middle of yourself that passes through your forehead, nose, and the center of your mouth. Now, on both sides of this line, on both sides of your face, shoulders, neck, and your body, if you notice any asymmetry that wasn't there before, you need to be aware of it, follow up on it, and keep an eye on it to figure out what the cause is. I should also mention that you need to be able to check the inside of your mouth. You should take a look periodically. You need to check your tongue. Take a look at your gums. Check your throat and pharynx. Especially in the throat and pharynx, again, the issue is asymmetry. Also, on the tongue and gums, look for any abnormal discoloration. Sores, erosions, or inflammation. You need to keep an eye on this. Anything abnormal, let me put it this way. And now, let's move on to the topic of urine color. We need to pay attention if it gets very dark, turns tea-colored, or starts looking reddish. There might be blood in the urine. It could be hematuria, so we need to be careful, and the same goes for anything abnormal in the stool. We should definitely keep an eye on things every once in a while to stay aware. If you see anything, well, anything abnormal in the stool, for example, if it becomes excessively pale or if you see streaks of blood in it. I should also mention that, quite often, people might see pieces of parasites. In short, if you notice anything abnormal, you need to be mindful that if it happens again or persists, you should follow up on it. Another area you should pay attention to is the eyes. Right. Take a look at the white part of the eye. If there's any discoloration, especially if it's turning yellow, you definitely need to be alert to that. Then, you can gently pull your lower eyelid down a bit with your finger. See if the lining behind the eyelid is very pale. That could potentially be a sign of anemia. It should have a pinkish look, not a deep pink. Right. A soft pink. If it's paler than that, you should get checked for anemia, a simple CBC test. If it's darker, well, that points towards inflammation. Then, if the sclera, the white part of your eye, for example, if that gets red, what they call pink eye around here, well, it's pretty obvious. Usually, the person themselves notices it most of the time. I've seen cases where the person didn't even notice it themselves, and someone else pointed it out, like, "Why are your eyes red?" Right. These are things we can look out for. As I mentioned, especially if that part is starting to turn yellow, they really need to go talk to our doctor to get some tests done, just to make sure blood bilirubin levels aren't rising, which can be a sign of various things. The next topic is the issue of oily skin and hair. What do you mean by oily skin and hair? I wanted to offer a bit of guidance. Look, there's been a lot of talk about this. I want to provide a practical tip that might just solve the whole issue for a lot of people. And that is, first of all, not all shampoos for oily skin and hair, even the ones that say they're for oily hair, are actually effective. Because the detergent strength of the shampoos is low, for one. And second, many of these products contain added conditioner, which is something that individuals with naturally oily skin really do not need in their routine. The next point to consider is that because the shampoo's detergent, specifically its detergent property, which refers to its overall degreasing ability, is quite low, this often fails to provide the deep clean that people with oily skin and hair require. Consequently, these types of shampoos simply cannot work effectively enough for those specific hair types, as many experts often point out. So, my own recommendation is that those who have oily skin and hair should wash their heads when they go into the shower in such a way that they need to wash with soap and rinse once, twice, 3 times, and use shampoo for the last time. So, they should wash thoroughly with soap 2 or 3 times, rinse, and then use shampoo for the final time so that the conditioner can, for example, help a bit to prevent excessive dryness. Although, for those with oily skin and hair, their hair is oily again 2 or 4 hours after they've come out of the shower. They don't really need conditioner that much either. And about soap, not every soap has high detergent properties, you know. Many soaps actually have conditioner in them. A lot of soaps don't have very strong detergent properties. I personally recommend the green spring soap that Costco carries in those big packs. But you really have to test it out, use it, and see which soap, when your hair is oily, completely gets rid of the grease after 1, 2, or 3 good rinses. This tip might just replace a lot of those overpriced, useless shampoos. This is for a normal situation where someone has oily skin and hair and doesn't have any other issues. But if you are noticing persistent flaking, scaling, and uncomfortable itching on your scalp, you should consider asking your local pharmacist for a coal tar shampoo or perhaps a selenium sulfide shampoo. Now, these treatments are sold under a wide variety of different brand names, which can sometimes be confusing. However, if you simply tell any pharmacy staff the specific generic names I just mentioned, they will be able to easily identify and provide you with the corresponding product that you need. And if there's flaking, burning, and inflammation, you need to see a doctor. I can't do that here. I can't provide medical prescriptions in a YouTube video. And they need to see a doctor to follow up and get it checked out. If, for example, it's a fungal infection on their skin, the doctor can prescribe an antifungal shampoo. If it's other bacteria, they'll need to be given an antibacterial shampoo, and so on. Right.